So each organ type is different, and as a result, their cancer risk is different. Lung patients get a lymphoma around 6% of the time, so that means 6% of the patients that will develop a lymphoma at some point in their life. So that's pretty high. Kidneys are much less, a little over 1%, and then hearts and livers are in between at 3 and maybe 2.5% risk during their organ transplant lifetime.
For a transplant recipient, what are the root causes of cancers that we need to be concerned about?
It's all related to almost all the risk is from the drugs being used. So for instance, the cyclosporin and the TAC, these are drugs that are also used outside of organ transplant. So let's say people with autoimmune diseases will get CellCept, steroids, and these drugs, just like a transplant patient would, and they're also prone to getting these cancers. So it's not necessarily the organ, pretty much all the risk is from the drugs. There are some issues with the organ, but it's mostly the drugs.
So whether they had a transplant or not, if they had these drugs, they'd face the same issues.
They face the same issues,
Okay.
correct.
And some of those drugs are more, cause more cancers relative to exposure to sun, for example.
Well, so there are the contributing factors. So skin cancer has the highest risk after organ transplant.
Okay.
Lymphomas are number 2, though. So around 10-ish% of cancers in an organ transplant patient will actually be a lymphoma.